Cameras on, you can just listen. I'm going to use my PowerPoint like I always do for exam number 3. It'll be 50 questions, 5 math as usual. Let me just make sure I get my PowerPoint ready for you. Any questions on the study guide before I start? No. All righty. Here we go. All right. Exam number 3. Lots of chapters 6, 7, 8, 11, 12, 25, 26, 27, 14, 15, 16, 17. It's a lot. Okay. We look at community. We look at the dimensions of people, place, and function. And we're measuring the dimension of people. The community health nurse would look at data sources like tourist bureau, civic groups, churches, libraries, police stations, welfare agency, and state departments would be data sources to measure the function. The dimension of the place would be measured with data sources. We look at things like politics, education, recreation, economics, and religion during a community assessment. Okay. So these are all the different areas we look at: spirituality, economics, community, safety and security, all those kind of things. Okay. We continue on to look at our active versus passive partner community partnerships. And so just like everything, active means that something's being done, and passive means like something's not being actively done. So if we have a community business that provides low low cost snacks to an after school program, that's going to be an active partnership because it's doing something specifically to help the community, and they really want to have an outcome that will benefit the community members. So if they create a new park or a hospital has a vaccine clinic, these are kind of more passive, meaning they're not as actively involved for working for the community. They're just helping for that one little thing. Data gathering versus data generation. We know that those are two different things. So when we look at data generation, it's our process of identifying data that does not exist. We're generating it. We're getting it, like stirring it up, okay? Generating it. So examples would be things like the community's values, beliefs, and social norms. It's not something that we can ask them because they're not going to be able to tell us the whole communities. They can tell us individual values and beliefs and social norms, but with this, we're going to look at things that don't exist, but we have to really observe them. And then we have data gathering, which is where we collect information. It's easy, like age, race, healthcare organizations, what's going on in the communities. Windshield survey you guys are doing for week number 9. It's a method to collect data about the community by observing the community through a car or riding public transportation. So in order to do one, you do need to know where does the community start and where does it end? Because if you're driving in your car, you can't just keep driving for hours and not know. Our population size, socioeconomic qualities, and government structures would be observed during the survey. We spoke about evidence-based practice in week 7, and that's a cultural change in practice. So it's going to bring improvement to both the nursing practice and to client outcomes. Our first step is always recognizing the current state of a practice and believing that care is based on best evidence, which is going to be our evidence with our different types of studies and things. Some barriers we see are adopting new technologies, knowledge of research and current evidence, and leadership and attributes of our colleagues. This week we did emergency prepared guide. What do we know about our disaster kits? Please know that we're going to teach a family to stock enough food for 3 days, review the kit every 6 months, and learn how to turn off the utilities. We will review every 6 months, make sure the food's still good, or all the supplies, okay? So you're gonna put a lot of stuff in there. You see in the picture here, you have a flashlight, whistle, radio, that kind of stuff, batteries, some medicines as long as they don't expire. Mass casualty scenarios we talked about in class, our priority is to evaluate the amount of time it takes to happen so that when it does happen, we are prepared. We have two different types of disasters. We have natural and we have man-made. Now, with our natural disasters, we have a federal emergency can be declared, and that would be the National Response Framework, and its role is to help the community. So it'll either help with transportation, temporary housing, medical resources, search and rescue, and firefighting stuff. Let's see here. Okay. We talked a bit about teaching and 3 different domains of learning. With a community-based education program, a nurse needs to figure out who are they teaching to first. And so they determine the population and then identify what needs to be educated. What theory are we going to use? Are we going to use cognitive, affective, or psychomotor? And then how are we going to implement that? So those are very important when we're teaching to our patients. We have the 3 domains: cognitive, affective, which I tell everyone 2 F's to remember feeling, and psychomotor. So it has the word motor, means you're doing something, you're moving. We look at ways to see was teaching effective. Our best method is the teach back method. So the nurse should have the client perform the skill to evaluate if the learning was effective. Okay. And what do we keep in mind when we're creating patient materials? We have to remember who we're creating it for. So this is a little small. I don't need you to know exactly, but just remember different generations like different things. Like our baby boomers, they really like more paper stuff and not electronic as much as you'll see with our Generation X. And our millennials are going to want a lot more like interactive stuff they can do, not like reading and things like that. Okay. Questions that we look to prove malpractice. Was there a doctor-patient relationship that existed? Was the nurse or doctor negligent? Did it cause direct injury? And did the injury lead to harm? Okay, that's how you prove medical malpractice. We have a liability, which we take a look at. We know that for liability, why is this so big? Hold on, let me try to. We have to have a provider provide reasonable care. A breach occurred through an act or omission to act, and then the act or omission caused injury or damage to the patient. That's how we know it's going to be malpractice. Healthy People 2000 was a national effort to improve health over 20 years. It has increased we have a 2010, we have a 2020, and we have a 2030. We're looking to see people's their health being improved regardless of their social determinants, like their education, their poverty, things like that. So Healthy People 2030 is trying to do that. The World Health Organization, the World Health Organization, we know, does a ton of things, such as monitoring drug reactions, establish standards for vaccines, disseminating research, provides information on internationally occurring diseases, and fosters collaboration for public health. Let me try to do this as a slide. Case management we spoke about this week. We know that their role is really coordinate care, get supplies as needed, schedule appointments, try to get the patients to really follow the care, okay? Make sure you do know that when you're making a plan as a case manager, they're individual to every person, okay? And so nurse case managers work well to meet the needs and health of coordination of care, okay? So we need to exchange information, we gather data, and we highlight values, right? That's how we develop our cases for our patients. STDs we talked about. Vaccines is our best prevention. We have bacterial and viral, and bacterial can be treated. Viral is harder to treat. STDs, the one that crosses the placenta, please know, is syphilis. And we have like these immunizations and infectious diseases that we're trying to prevent with Healthy People 20, like our vaccines, our big thing, STDs, pneumococcal. All right, for our vaccine, what I want you to know about 2 of them. DTaP, normal to have swelling and redness at the site. What do we do for it? Just give them an ice pack. Why would we not give hepatitis B? to a patient if they were allergic to the first one. So these are 2 vaccines. I want you guys to be specific and know. Side effect, normal to have swelling and redness at site for DTaP, and for Hep B, we don't give it if they've gotten another dose that had a reaction. Okay, let's see here. Surveillance, we talked about this week. Purpose of observation is to assess the public health status of disease patterns. We're trying to see what's going on, set priorities, develop programs to get a response. Purpose of surveillance is to reduce morbidity and mortality. We have 2 different surveillance systems that we use. We have that passive system where we wait for healthcare providers to report information to the health department, and then we have the active where the health department goes out and has nurses figure out what's going on. That's how we do our observation and surveillance, okay? We have different types of outbreaks, which we talked about in class. You have your point source, you have your intermittent, which is going to be when you have something like food poisoning. So it's intermittent, people get sick at different times with same source. Mixed outbreak occurs when one person's exposed to a source and then spread the disease, such as influenza. Propagated outcomes do not have a common source and spread generally from person to person. So like, we don't know what the source may be, but something like tuberculosis. When developing community-based programs, the nurse will conduct a needs assessment. During the pre-active stage, the nurse will project future needs. During the reactive, which means we're reacting, determine the problem that occurred, and the inactive defines the problem based on existing health service. So I don't really think you need to know that, but that was just a little aside. All right, when we take a look at here, we are looking at very important continuous quality improvement. Quality improvement is the structured approach to improving performance. It focuses on preventing and identifying improvement opportunities. Quality assurance focuses on accountability, fixing blame, and proposing a post-event investigation. Example, we create a new procedure after an error. During the initial phase of our quality improvement, we're trying to fix things. We've got to figure out what everyone's doing along the path. So we have to clarify our job descriptions. Things to remember with quality improvement, you're going to look at patient-centered care. We know our patient is the center of the care. We have teamwork and collaboration. We have quality improvement. We have evidence-based practice and safety. Make sure that we're not hurting anybody. Okay, so all those things to remember. We're always looking to improve. With quality improvement, we're improving performance and client satisfaction with our staff awareness. We're going to skip that one. There's different phases of the quality improvement program, and you can see that. And the first phase is the structure phase. This is where we determine what the philosophy and alignments are and who does what, so we can change it. During the process phase, the nurse evaluates the quality of care, and in the outcome, we evaluate the results and say, what can we do better or worse? We have information on ethics, which we did this week, our ethical principles, autonomy, justice, utility, beneficence, and non-maleficence. Okay, we all know those. I gave you guys clues on how to remember them. Utilitarianism is an ethical theory that the outcome is key, so what we do must justify why we're doing it. Okay, so know those 2 definitions. Social equity, feminine ethics advocates for economical, social, and political equality. And caring ethics is based on mortality of relationships. Immigrants, we had a chapter on that. Immigrants often face financial constraints, language barriers, differences in social, religious, and cultural backgrounds, traditional practices, lack of a healthcare provider. Family conflict often occurs too when we have our immigrants, if they have come from a change in environment, and the challenge is pretty difficult to adjust to. When we look at our refugees, please remember about trauma-informed care. They're coming here from another country, and our priority for them is to make sure they get care. Okay. We looked at different cultures. Native American, we want to remember they are past oriented. So if you tell them make an appointment in a couple weeks, they won't remember that. So you need to schedule that appointment for them, okay? So, and they're gonna prioritize the nurse as an authority figure. With our Amish culture, know that natural and alternative treatments are common. Church is important. Organ and blood transfusions is not prohibited. And the rest is math, 5 math things. Any questions on that review? Sorry, it got really dark. My light shut off. Any questions on the study guide that you wanted to go over? No? All right, I covered a lot of topics, but we did have a lot of reading for this exam. If you need any help at all, please schedule a private session with me. I will post this recording and post other teachers' recordings as well. Any questions? Everybody's probably sleeping by now. Anyway.
No, thank you.
Thank you.
All right. Good night, everyone.
Good night.